Welcome to the Woman Aesthetic Podcast. Join us in seeking deeper meaning and striving to live fully in our womanhood. Welcome back to the Woman Aesthetic Podcast. I am your host, Anna. And today on the show, we will hear from Dr. Jessica Miller on how we can best support our fertility and hormone health. So Dr. Jessica Miller is a board-certified OB-GYN, fellowship trained in endometriosis and infertility surgery, and she is the physician behind @Dr. Jessica Miller on Instagram. She helps women uncover the root causes of infertility and combining the best of modern medicine with a whole person approach. Through her clinical work and growing online platforms, she is changing the conversation around fertility from IVF first to individualized care that heals. Dr. Miller, welcome to the podcast.
Hi, thank you so much for having me. I'm so passionate about this topic, so I am absolutely pumped to be able to talk about this today.
No, I am excited as well. It's interesting and actually really wonderful to hear that your approach to fertility struggles is individual care that heals instead of just offering IVF first. And this is not something that we hear often. So please tell us more about your approach.
Yeah, absolutely. So I went through a conventional residency for OB-GYN training. I was out in practice for a couple of years, and I just noticed that I was increasingly frustrated when I would have infertility patients come to me, and I just felt like I wasn't able to give them the care they really needed. And often, if I referred them on to someone else, the only option that they got was either IUI or IVF. And so that was really tough for me because my heart just goes out to these patients. It's such a common struggle. And I just really felt like there were better options for them. So at that point, I decided to go back and do some additional training in something called naprotechnology, which really focuses on surgical and medical management in root cause, addressing the root cause of infertility instead of kind of overriding the process with IUI or IVF. So at that point, I just was excited to be able to offer patients something more individualized, something that's really getting at the root cause of what's going on, and to give women who are carrying such a heavy burden hope.
Mm-hmm. Yeah, it is crazy because I think we all know a woman or several women who are suffering through this in one way or another. And sometimes it is a long road. And sometimes it's things that come up like miscarriage, and you don't understand why it's happening. But I think it's really heartbreaking to see how widespread it is. And I don't know if it's something that has always been the case. Like we've always known several women, but in this generation, I there's people that I've went to college with, people that I have met that I'm like, I am learning so much about this. And it's so heartbreaking because even we as, just as friends, not even as professionals, like in your shoes, but just as friends, like how do we, going through it, how do we support friends when they're getting shut down by people who should be offering them options?
Yeah, absolutely. Yeah. So the current infertility rate is estimated to be 1 in 6, which is absolutely mind blowing. I mean, I think there's definitely a component of we're talking about it more. People are trying to have children later in our current society. So I think those things are contributing. But my sense is still overall, these rates are really rapidly rising. And unfortunately, we don't have a lot of good insight into that at this point. And I'm hoping in the future we'll have more research that will help us understand that. But in the meantime, my focus and physicians who are doing work similar to mine are really focused on how can we address that root cause and try to help these women. The 1 in 6 figure just blows my mind because if you're standing in a room of, X amount of people, how many of them are struggling with infertility? And you're right, so many of them are going through it kind of silently and struggling with that. And it really just breaks my heart. I was blessed to become a mother within the last year, and I'm just so grateful to God for that gift. It has just been the most incredible experience of my life, and it has even further fueled my passion for this because I want other women to be able to experience this. Those women who want to do this and who are struggling. So I think you're absolutely right. So many people in our lives, whether we realize it or not, are struggling with this and they need help, they need support. And unfortunately, I don't think the healthcare system right now is really offering that. And so I, along with many other physicians in this field, are trying to be different than what is the current option for women.
Yeah. And well, congratulations. That's so exciting.
Oh,
Starting motherhood and things. And that is, it is such it is heartbreaking because it is this want and understanding the goodness of having a child. And I completely understand people jumping on the train of IVF when that's presented as an option of like, here, we'll fix your problem. You would like a child. This is a solution instead of you would like a child, but you are also suffering in some way. And I would like to uncover that. And maybe, in the end, we can proceed and you
yeah.
can bear children.
I cannot tell you how many women are coming to us, at this training program that I'm at, who have been struggling for years, potentially a decade or more, and they were never given an answer. And like you alluded to, part of this is fertility, but part of this is just overall well-being and health. Women are struggling with severe pain. They're struggling with mood fluctuations, severe PMS symptoms, things that are affecting their quality of life. So while fertility is a focus for us, we also want women to be able to feel good and to be able to operate and function. And so, there are some patients who come to us not for fertility and more so to focus on that. But overall, we try to encompass both of those things. But truly, the number of women who come through the door who, they never got a full workup. They were just told you have unexplained infertility and we should do IVF. There was no other discussion. And that's really frustrating to me because we almost always, I would say 99% of the time, we find something going on that we can address to help them potentially conceive naturally, which is really the goal.
Yeah. Well, that's actually something that I wanted to ask you. Just kind of like, what is the reason that women are often offered IVF first? Like, is it really the lack of knowledge around the reason for their fertility, which is kind of what you're talking about. But on
Mhm.
the flip side, I can't help but ask myself, is it because IVF is a billion-dollar industry? And it's, that's hard to let go of that profit if women are finding, end result and how to fix what's going on and have just a healthier life. Like I do wonder about that.
Yeah, absolutely. I think a lot of the physicians who are participating in IVF are well-intentioned. I think that they really truly feel like they're helping people and they're doing the right thing. But I ask myself the same questions because IVF often is not even covered by insurance. So it's a large out-of-pocket cost. And you're right, it's a high generation of income kind of business. So, I do have some questions there as well. On the flip side of that, the treatment that we provide often is poorly reimbursed by insurance. It's not lucrative. And we do it because it's the right thing to do. And that's really our focus. But there is definitely somewhere in women's healthcare, things are ultimately sometimes driven by the dollar. And so it is frustrating to see insurance companies not acknowledging hormonal imbalances, the need for endometriosis surgery, and how long and complicated that can be. So I think some of this is those large companies that are behind the scenes who really are not in support of the type of work we're doing instead of just going to IVF. So I do think there is something kind of on the bigger level at play as well.
Mm-hmm. Yeah, I looked up the numbers, and this is anybody can Google this.
Hmm.
And this is taken straight from the internet, so I have not modified this at all. But it said IVF's global value estimated to be around 36.5 billion in 2024, and it's projected to grow significantly in the coming years. So factors that they said was factors such as rising infertility rates and advancement in reproductive technology are driving this growth. And so what I found really interesting reading that was it's already factored in and it kind of accepted that infertility rates are going to rise. And so instead of saying that it
Mhm.
might be a contributing factor and in the future, maybe it won't be really a factor because we're working to figure out what is going on and how to combat it. But they've already factored in like, oh, whoops, like it's just a rising fertility rate. And I
Mhm.
don't know. I'm like, why
Yeah.
are we seeing this rising infertility rate?
Exactly. And, I ask myself that question all the time. Unfortunately, it's really hard to research because so much of what we're exposed to as a society you almost can't find a group of people not exposed to certain things, if that makes sense. So I think the research is really tough to do, but I have the same questions. It's really tough to kind of wrestle with that, why we don't have better answers for that. One thing that I see very typically, that individuals who have a diagnosis of unexplained infertility will come to us, and actually the number one thing we find is endometriosis. So I see many, many women who have never been evaluated for endometriosis who are just told that they need to do IVF. So what we do is, one, look for it, see if there is that diagnosis, which very often there is. And then two, we remove it to improve natural fertility rates. And then our goal is to help you to get pregnant naturally now that we've removed the endometriosis. And again, hopefully that's also improving your quality of life. If you were experiencing bowel symptoms, bladder symptoms, chronic pelvic pain, those things should improve with that surgical management. I think some people get held up with that because the only way to definitively rule in or rule out endometriosis is surgical. You have to physically look for it with the eye. And so I know that sometimes that's kind of a barrier for patients, but the results of looking for it, removing it, are so great. And we see such a wonderful response in fertility and quality of life that it is so worth it.
Mm-hmm. Do you think that endometriosis is kind of the main thing you see in this infertility struggle that women are facing?
I would probably say it's the most common. Anyone who comes to us who has been trying to achieve at least 6 months with timed intercourse, so being aware of ovulation, timing intercourse with that, if they haven't conceived within 6 months, we always are doing a full evaluation, which includes looking for endometriosis. And the vast majority of those patients do have that diagnosis. So there are other things sometimes that we look that are common as well, such as PCOS, but endometriosis in an infertility population, I would say the majority of people really do have that diagnosis.
Mm-hmm. Okay. Well, the CDC website, I looked on the CDC website. So I'm like, let's be official. Let's get some numbers here. And because I was searching why are we having, well, first of all, what are the numbers that we're looking at in terms of women having children? And they brought up maternal age distribution. So it presented it as that. And so they said, this is per the website, it says in 1990, females younger than 30 accounted for 7 in 10 births, while in 2023, they accounted for less than 1 in 2. And I was like, that is a huge jump. And maybe, obviously, I think there's lots of factors that go into that, including things like choosing not to have children or even having children when they're older. So the age distribution, obviously, is just more spread out. But I'm like, but how much is that is infertility? It didn't mention it. It mentioned that, and it mentioned immigration as like a positive thing, and that's kind of, we can balance out our population. Which I'm like, you're not addressing
The issue.
the women. The women, like, how much is this related to infertility?
Mm-hmm. Yeah, no, it is definitely playing a role that women are having children later in life.
Mm-hmm.
But again, I really do think overall those rates are increasing, and other things that we're seeing that maybe not addressed on a conventional workup would include like hormone imbalances. So for example, throughout the menstrual cycle, your hormones are meant to be fluctuating in a certain pattern and should be at certain levels, in particular your estrogen and your progesterone. So those are things we look into as well. And again, unfortunately, we don't know why people have these hormone imbalances, but we know that if we identify them and we treat them, we see that improvement in fertility and sometimes also in some other symptoms as well. So I think the biggest thing that I'm excited about is being able to offer a more complete workup instead of what's typically offered, which is just maybe a baseline set of labs, a baseline ultrasound, and then, if we're not getting pregnant with a couple of meds, we're off to IVF. So really kind of diving into, do we have endometriosis? Are there any abnormalities with the uterus itself? Are there any hormonal abnormalities? Any issues with ovulation we should be looking at? That kind of gives us the bigger picture. And then when we focus in on the problems, we get those results that we're looking for. And I'm really hoping that the rest of medicine will start to catch up with this as well, instead of just the shuffle to IVF. But it's just exciting to be able to offer something different, especially for women who are looking to really find out what is the root cause? Why am I struggling with these symptoms or with infertility?
Mm-hmm. I'm glad you brought that up because I was hoping we could go through some of like the common causes of infertility. So like PCOS, endometriosis, and even miscarriages. And I don't mean to exclude any of the other issues. But I just have seen these as the most common issues from the women that I know. So I thought maybe that would be a good place to start. So with I mean, let's start with PCOS. Let's just dive in. What exactly is it, and what causes it?
Yeah, so PCOS is a hormonal imbalance that women experience where they essentially aren't ovulating regularly like they should. So those women will often report, not always, but often will report maybe a cycle every 3 months, maybe a cycle once a year. They're not having regular cycles as they should. So that automatically, if you're experiencing that, if your friends experience that, that's a red flag that you really need to get evaluated. So that's the number one thing that we see with PCOS is just an inconsistent ovulation pattern, which tells us the body is not healthy. With PCOS, women also experience things as difficulty with weight loss or experiencing weight gain. Insulin resistance is an issue. It's often associated with metabolic syndrome. So, kind of also some systemic issues that really should be addressed for the health and well being of the woman. And then another thing that those patients often will report or will see on labs is elevated androgens. So, they might just have an elevated androgen on their labs, or they can have symptoms. So, abnormal hair growth, acne, those types of things that they're noticing that are bothersome to them. So, those are the patients that, if you're experiencing any of that, really should be seen by a professional. And naturally, if you're not ovulating appropriately, your fertility is going to be affected. So those patients, there's some surgical management we use for that, but also medications that we can address those issues to help them conceive naturally.
Mm-hmm. So I mean, is it something that you're just born with? It's not something that's outside environmental factors that are coming in and kind of disrupting what's going on in your body?
That's such a great question. It's really hard to say. We definitely see a familial component. So, it's hard to say. If I had to guess, I think there's probably a little bit of both there, both environmental and genetic. Um, it's really hard to say. Again, unfortunately, in women's health, the research is really we don't have the research to say why a lot of these things are happening, which is so frustrating.
Mm-hmm.
But I definitely think a little bit of both going on.
Mm-hmm. And with endometriosis, which treat women with endometriosis, excuse me, can you tell us what that is and what causes that?
Yeah, so endometriosis is when there are implants of abnormal tissue that, instead of typically being present within the uterus, are implanted outside of the uterus.
Mm-hmm.
It's the same type of tissue, but it's in the wrong spot. That tissue is then kind of causes an inflammatory process as well and can lead to adhesions within the pelvis. Depending on the extent of the endometriosis, it can cause very significant damage to the pelvic organ. So with that condition, we see that when we remove it in a specific way in its entirety, your symptoms and your fertility improves. So typically, historically, some people have just kind of burned those lesions. We really go out of our way to ensure that we remove it in its entirety. So we circumscribe the lesions, we remove them, which is nice because it gives us a pathology diagnosis so people really know for sure that that's what's going on, but also is more effective in preventing recurrence. Unfortunately, often, or maybe not often, but endometriosis does reoccur in some patients, particularly those who have a more severe case. And so we try our best to treat it in a way that decreases recurrence and then also prevents pelvic adhesion. So you can imagine if I went into your pelvis and there was endometriosis everywhere, all this inflammation everywhere, and I remove it, but I don't repair it in a certain way, things could get stuck together, adhesions can form, and that ultimately might make a worse situation for you in terms of pain or fertility versus the type of care we provide in our specialization is really repairing things in a way that is very meticulous to decrease the rate of adhesion. So we really are doing meticulous, thorough surgery to make sure that we're protecting those organs that you have because you only get one set. So we have to be extremely cautious with those and really preserve your fertility through a very thorough type of surgery.
Mm-hmm. And is this also something that you are born with, or is it something that could run in the family in the same way that PCOS can? Or is it something that's from, outside factors?
Yeah, so there's definitely, again, a familial component to this as well. We do see a higher rate if you have a relative, particularly if it's a first degree relative, your risk definitely increases. We do see it in teenage girls at times. So it's not a disease that only occurs at a certain age or only occurs in older women. But again, the research is so spotty. We don't know for sure why it happens or what's causing it or why some people have a worse case than others. But likely, again, probably both an environmental and a familial component to it.
Mm-hmm. And it's also concerning that if the rates are rising of infertility, how much this is just spreading more and more and more. And it's encouraging to hear doctors like you are like, no, we're going to study this. And instead of putting a Band-Aid on it,
Yeah.
we're going to, hopefully the next generation will have better outcomes and care. Then I think we're at the moment, we're kind of in a battle between trying to go more of in a direction of like root cause instead of
Yeah.
just give me what you recommend kind of thing.
Yeah. I think more and more women who are in this struggle, in this journey, or just in general in their lives are really taking their health very seriously and they want a root cause answer. I don't think women want band-aids. I think they really want to know what's going on, how they can feel better, and a more natural approach to things. So that is a huge benefit of what we do is it's a very natural approach. It is invasive in the sense that we do surgery, but the whole goal of what we're doing, whether surgical or medical, is to restore your normal function, to restore your normal hormones. We're not trying to do anything to override the body, override your hormones. We just want to support it so that it is working as God designed. So I think women are really kind of waking up and wanting to hear that message. And I think that really resonates with a lot of people.
Mm-hmm. Oh, absolutely. There's definitely a big movement, just even outside of supporting fertility. Like if you're noticing issues with your fertility, to have a more holistic lifestyle. And I think we're definitely coming out of the wave of it being weird, that you would want a holistic lifestyle, which is
Yeah.
just, I just want things more natural in my home. Like I want, give me the good food, the good air. I want things that don't have toxins. And, yeah, for a while it was looked down. I was like, oh, you're really weird and you're really crunchy. But I think we're all seeing how it's affecting us or later on. And for women, very clear sign is our fertility. It's just a very clear sign that there's something wrong with our environment and what we're consuming and our products are, our cosmetics, everything like that.
Well, and it's really amazing because your menstrual cycle is kind of a vital sign, right? Like if you are having a normal menstrual cycle, if you're having a normal mucus build up to ovulation, which some women are really in tune with, that's kind of like a little health report for your body. How is your body doing? Because the body is meant to reproduce, it's meant to ovulate. So if you're not doing that, it's pointing to something deeper. So this is really important, especially as women, to just be in tune with what is going on with your body. So many women have spent their entire life on birth control, and so they've never even experienced what is their normal cycle, what are kind of those changes that they experience every month. And it makes me sad because it's so beautiful. And again, it just points to so much more going on with your body.
Yes, and I'm glad you brought up the pill because I was going to ask you about that. I mean, ever since I was in high school, I remember a friend was like, "Yeah, I'm on the pill," and of course we were like, "Oh my gosh, like you're 15, like what's going on?" And she's like, "No, no, no, it's for my acne," and I was like,
Mhm.
what? Like even back then, I mean, I obviously did know anything. I was 15. But it struck me as really odd. I was like, okay, so you're on the pill for your acne. Like I was really confused.
Yeah.
And now, we're learning people are prescribed the pill for everything from acne to regulating their periods. And I'm just wondering, is a pill really a solution for treating something as complex as our fertility and all these different symptoms that arise?
Yeah, so kind of like I was alluding to earlier, the work that I do and NAPRO physicians like me, what we do is to support the body's natural mechanisms. What the pill and other hormonal forms of contraception do are kind of override the hormones. They provide steady states typically of the hormones that kind of shut down your body's natural function and and give you kind of just synthetic hormones, right?
Mm-hmm.
And so yeah, that really isn't addressing anything. It's just covering things up. So if you have PCOS, for example, and you're only having a cycle every year and you're on the pill, now you can have a cycle every month. Is that fixing anything? No, it's just synthetic hormones inducing a bleed every month. It's not even a real period. So for me and for physicians like me, really, we're trying to get at the root cause and actually treat things. We don't want to cover things up. And the other thing I see so often is, say that you have an issue when you're 15, you're on birth control for 10 years, now you're 25, you want to get pregnant. We could have started addressing things 10 years ago. We're behind the ball. We never got to the root cause of what's going on. Same thing with endometriosis. It can cause a lot of pain, a lot of symptoms. And so those women are often placed on hormonal treatment for that. So again, instead of surgically addressing it, removing it, really, again, at the root cause, you've just covered it up for 10 years. Potentially it's worse now. And now you're worried about your fertility. And now we're finally getting to it. So when I see hormonal birth control given to patients, really, to me, that just says that that was a Band-Aid that was used. Nothing was really addressed. And again, I think women are trying to get away from that. For women who are using hormonal options for contraception, the amazing thing too is that there are a lot of natural options out there that if you're in tune with your body and when you're fertile, when you're infertile, they're highly effective in either avoiding or achieving pregnancy. So I think that's a great option for women who can have a lifelong tool to either, maybe pause on their family or to build their family, even if they're, just normal fertility. So that's something that I end up talking to my patients a lot, is just natural family planning options.
Mm-hmm. Do you see, do women come to you when they're on the pill and then getting off the pill and then seeing them after? Do you notice any change?
Often women coming off the pill will have some symptoms with that, like irregular cycles. Their body's kind of trying to get back to whatever its baseline is. Um, for some women, that might take longer than others. By the time women come to me, they're usually trying to get pregnant, so they've been off of it for a little bit.
Women coming off the pill are realizing that people that they want to date or have kids with, or even just have sex with, it's different than who they're with. So they're just like, their whole world is blown.
Yeah,
Like, I don't know if, I don't know if you're like, if I'm making myself clear, I guess.
no, I completely understand what you're saying. So I think I've definitely heard that before, that having synthetic hormones changes who you're attracted to.
Mm-hmm.
Um, I'm not sure if there's definitive evidence behind that. I'm not 100% sure on that.
Mm-hmm.
It wouldn't surprise me. I think there's a lot that we don't know about hormonal contraception. And again, I just think there are so many better options out there. So
Mm-hmm.
I really enjoy talking to my patients about, again, natural options to either avoid or achieve pregnancy. I think that even if you're having other symptoms like pain or irregular cycles, I just think there are better ways to treat it.
Yes, no, absolutely. I would agree. I feel like there's always a natural way, like nature is here to help us, and our bodies can heal. They're wonderful things. And I think having things that mask it's not helpful. You're just kind of delaying issues,
What,
like you said.
for example, the progesterone that might be in a contraceptive method is going to be a synthetic form, versus when we support progesterone in women who have low progesterone levels, we use something that is bioidentical. So
Mm-hmm.
we also really try to use formulations that are more consistent with what the body should be making.
Okay. Well, that's super interesting because some women, including myself, have had miscarriages because of low progesterone. And I know some women have to like have injections. I personally had to have the pill version of progesterone in my first trimesters. Two, was it? No, all three of my past pregnancies. Is that a healthy way to support, or is there a better way to support progesterone?
Yeah, so miscarriage is just such a heartbreaking thing. And so for women who, especially those who have experienced recurrent miscarriage, something that we focus on that maybe a conventional OB-GYN might not be as dialed into would be a low progesterone level. So miscarriage happens for a variety of reasons. One common condition that causes miscarriage that we can address would be genetic factors. There's nothing we can do about that. But a common cause of recurrent miscarriage that we can address is low progesterone levels. So once you ovulate, your body should increase progesterone levels to kind of thicken the uterine lining, prepare for implantation, and then to support early pregnancy. So often women will have signs that when they have their cycle, their progesterone after ovulation isn't what it should be. So even before you're pregnant, often there are signs that you have low progesterone that we can start supplementing even before you get pregnant. So that might improve some symptoms you're having or, help you to really avoid a pregnancy loss. Outside of that, if you're kind of at that point where you already are pregnant, that's something that we check on all of our patients is a progesterone level to see if they should be supplemented in pregnancy as well.
Okay. Well, that's good to hear. Because, well, luckily my OB-GYN, the first time I had a miscarriage, I was 9 weeks in, and he was like, yeah, you have, you had low progesterone. And so then the following time that I got pregnant, he was so good about getting my blood work done, and then, kind of prescribing it right away. But I know that's not the case with all women. And sometimes we have to fight for it. Like when I was on the phone with the nurse, she's like, well, you'll be seen at this time, your routine check. And I was like, no, you don't understand that this is an issue. I know it's an issue. Can you let him know? And it was just insane. Cause I'm like, this simple thing, not simple, but one step thing. It's women have to advocate so hard for themselves. And is that, I mean,
Yeah, unfortunately.
hopefully we're coming out of that, right?
So, I just, unfortunately, I think we just kind of see that across the board, whether it's, when you're on the pediatrician, when you're being seen for yourself, I think you really have to advocate for yourself in a lot of ways. And
Mhm.
I think the healthcare system just has a lot of issues right now that make it really difficult. So that's part of my goal in being on here, being on Instagram, being on this podcast is just to give women more information because I'm passionate about this and I want women to know this. And unfortunately, I think it's not as well known, but I think you're absolutely right is a lot of women really end up advocating for themselves. And so if I can at least help and empower women to do that, I feel like I've done my job. But yeah, for all of our pregnancy patients, we always check our progesterone level with that HCG to kind of just see where they're at, and then based on that level, we decide if they need progesterone, how much progesterone they need, and in particular, if you've had recurrent miscarriages, that absolutely should be done. And I would really advocate that you get your progesterone levels checked before you're even trying to conceive, so that way you can start progesterone with your cycles at the appropriate time because really, by the time you find out you're pregnant, that ovulation, that conception has already happened previously. So if you can start your supplementation earlier, that really would be beneficial.
Mhm. And would you recommend women? I mean, some women would have, one miscarriage and perfectly healthy pregnancies. Some
Mhm.
women would have a couple right in a row, or, just kind of between their other, um, having other children. When would be a sign that that's a problem? Is it if you're repeatedly having miscarriages, or is one enough, or what are kind of I guess, your recommendation of when women should go
Yeah.
see someone?
I think if you're 100%, if you're having recurrent miscarriages, progesterone is likely playing a role. However, even if you've had one miscarriage, when you talk about the risk versus the possible benefit of just checking progesterone, supplementing progesterone, it's so worth it. It's overall a low risk medication. So even if you just had one miscarriage, and often we don't know, is that from a genetic issue? Was it from progesterone? Often we'll never know. Like when a patient comes to me and she's had a miscarriage 5 years ago, I won't know why she had that miscarriage. But it's so worth just supplementing that progesterone because, again, the potential benefit of really supporting that pregnancy is so much greater than the risk of taking a bioidentical hormone that
Yeah.
is needs to be elevated in pregnancy anyway.
Yeah. Well, I know that some of the people that I know have said, they've expressed concerns, to their OB-GYN, and they're like, well, let's wait till you have this many miscarriages. Do you think that's hopeful, that should be the approach, or do you think that, I mean, we should, if the woman expresses concern, should that be checked out, or is there really a better way of doing it, I guess?
Yeah, absolutely. I mean, of course, if you've had multiple, you should have a workup for that. There could be other things at play as well. But again, just I hate this idea of forcing someone to go through X number of miscarriages before checking
Mhm.
something. That doesn't really sit well with me. So I just think that if you're pregnant and your progesterone level is low, there really is low risk in supplementing that. And then just continuing to monitor it. I agree, it's really hard to find a physician who's on board with that because it's not really conventionally done. But in particular, you're in St. Louis, there are multiple providers in St. Louis who are available for that. So I think you can find people. It just takes a little bit of shopping. And truly, you want a relationship with your physician where you feel comfortable, you feel like they're listening to you. So it might be worth shopping around just to find that.
Mhm. No, I agree 100% because yeah, in the long run, your your family matters, your health matters, and sometimes having that really tough start, it's worth it. It's the same with pediatricians. It's the same, with everything else. It sometimes takes a little work. And I know that, not all women are having to suffer through these things, which is thank God that it's not the case, that it's not everybody. But for just in general for women, how can we daily best support our fertility and our hormone health?
Yeah, absolutely. Unfortunately, we live in a society that is so fast paced that I think people have just really not had the opportunity to take care of themselves. So, the first thing I would really say is just kind of taking a step back and really evaluating what you're putting on your body, what you're putting in your body. First and foremost, I would say absolutely focusing on a whole food diet. We have strayed so far away from that as a society, again, because of the convenience, the fast pace. People are just trying to make it through the day, and I totally get that, but there are consequences, unfortunately, and they go far beyond fertility, right? So the first thing I would say is really focusing in on a whole food diet. And when, sometimes patients are even a little bit confused as to what that means. And so then I say, just use about one ingredient. If it's a one ingredient item, that's a whole food diet. And of course, not everything is going to be, a whole food, but to the best of your ability. So fruits, veggies, meats, really being the primary focus. And then of course, exercise, trying to be more active. A lot of things, again, that just really don't fit well with the jobs that individuals have. So that's usually where I ask women to start. And unfortunately, is that can be a really big change for women to like really think about their diet and focus on their diet, and some things that we've been told or taught that are healthy maybe really are not, so for example, I think we have some like alternative um, food options that really have been marketed as healthy when in reality we really should just again be focusing on whole food. So sometimes it's a re-education process as to really what is good for you.
Mhm. Oh, that is so true. And it also is, like you said, it is really hard because society isn't really set up. It is harder to find good meals to
Mhm.
make that aren't filled with, even if you're buying single ingredient things, there's just like a bunch of different fillers in it, and you're like, okay, do I have to make my own butter now? Do I have to go and make it
Mhm.
almost seems impossible. But I'd love to talk about the cycle for a minute.
Sure.
What I know people are really learning about like the four different points in the cycle, and there's some things that have been told us that are fine. Things like really painful periods are said to be fine, so just expect to have your heating pad and your extra strong ibuprofen. um is
Yeah.
that actually normal?
No. I would say that to have some be a little bit uncomfortable could be normal, kind of depending on your other symptoms. But for women who are having life altering symptoms, you are having trouble getting out of bed, you can't function without medication. That is not normal. It is not normal. And I think you're right. I think we've been told as women that it is normal. You just kind of suck it up and deal with it. But the fact is that really needs to be evaluated. So I would definitely say if you're having symptoms that are affecting your quality of life, you really should get worked up for that.
Okay. Yeah, because The pain thing, I think people are, they're having to go to work, they're having to continue on with their day. Some of us, are curled up on the bed in pain and they're just told to power through it. And that's the norm. But yeah, recently all these, studies are coming out that's saying that's not normal. Get it checked out. Like you said, like there should be discomfort, there's things going on, but something that's so debilitating, that is not that's
Yeah,
not how your body should be
I
working.
completely agree. And unfortunately, the average woman, if she's having those symptoms and she goes to the OB, she might be either reassured that they're normal or, again, placed on hormonal contraceptive that covers up those symptoms. So, again, we haven't gotten to the root cause, which in that situation very likely could be endometriosis. And again, you're kind of kicking that can down the road, and then fertility becomes an issue as well. So, I think always better, no matter how young you are, just to get it checked out and really figure out what's going on.
Mhm. The other thing I wanted to ask you was with the cycle, some people experience horrible PMSing. So it could be anything from like severe depression,
Yep.
severe anxiety, just really bad mood. I know that sounds like really weird. I don't really know what the symptom would be called, but just like even aggressive or yeah, just in a really bad mood, but it's so strong that you don't recognize yourself. And again, that's one of these things that women are said, well, you're just a monster for a couple days and you're just going to have to like stay away from society. But is that normal?
Yeah, no, PMS is a huge issue. And I think we even kind of laugh it off. We say, oh, she's just PMS, like it's kind of like a joke, like it's not a real thing, but it's definitely a real thing. And again, conventional medicine just treats that with the pill because you cover up the hormones. And if you don't have those hormone fluctuations, then you probably won't have those symptoms. But our solution is really to support the hormones that are imbalanced. So after ovulation, again, your progesterone should increase. If it's not increasing appropriately, we see that associated with these symptoms. So with fatigue, feeling irritable, easily tearing up, fatigue, insomnia, breast tenderness, headaches. There's so many symptoms women experience kind of after ovulation and then kind of before or through the first couple of days of their period. So if we can support their progesterone, that typically improves their symptoms. And we have multiple ways of doing that. But really, what we're finding is those symptoms are a sign that your hormones aren't in the right place. And if we can support what your hormones are supposed to be instead of overriding them, instead of covering them up, we see an improvement in symptoms. And then also, that kind of plays into the progesterone needed for pregnancy. So, those women also often are going to be someone who might struggle with early pregnancy loss or having a low progesterone. So, it's kind of twofold. And again, kind of just points to the overall picture of taking care of your fertility also has a lot of implications for just your overall health and well-being. It's a full person picture.
Oh, I agree 100%. With our hormones, are there things that we should be avoiding that are just completely wreaking havoc on our hormones?
Yeah, that's a tough question because again, the research has just not really been done, frankly. So I think that a lot of women kind of take a very broad approach of limiting their environmental exposures to see if that helps.
Mhm.
Unfortunately, at this point, we don't have any direct evidence that, if we, avoid X, Y, and Z, that will improve our hormones. Um, so unfortunately, we don't have the answer to that right now, but I think a lot of women are kind of just taking a more generalized approach. So really looking at, what's in their laundry detergent, what's in their cleaning supplies, what's in their cosmetics, and kind of just to the best of their ability, because that can be really difficult, kind of trying to address that along with, again, addressing the foods as well that you're putting into your body.
Right. Is that something that you normally recommend to the women that you see when you're working with them? Is there steps that you take um, when
Well,
when you are encouraging them to kind of focus a little bit more on their environment?
yeah, so I definitely always encourage whole food diets and exercise. In terms of those other environmental factors, because there's no specific data, I don't want to put people through the stress of those changes without knowing that there's actual evidence that it's going to improve their hormones. So that is something that why I personally really work on and is something that's important to me. Infertility is really tough because those women are already going through so much. And the last thing I want to do is put something on their plate that I can't say for sure is going to help them. So I try to be really specific in what I recommend for patients because, again, the stress that you're putting on them through making all these changes, just the stress of changing your whole diet, that's huge. So I
Hmm.
try to be really realistic and cautious with what I'm recommending to patients because again I only want to do things that are evidence-based. So even though that's something I really personally am passionate about, for patients I try to start with things that I 100% know are going to be good for their overall health.
Right. And that makes complete sense because yeah, I think my heart just goes out because after you've been going through it and going through it, you do kind of want to.
It's exhausting. It's exhausting. It's horrible. It's an awful process. And just the energy to keep going. Like if you've been struggling with infertility for a couple of years, just the energy to keep going every cycle and the emotional toll of getting a negative pregnancy test every month. It's so much for patients. So I try to be really realistic and really really focus on what I think is most important because it's already so emotionally taxing for people.
Hmm. Is there other things besides kind of like the ones that we've talked about, PCOS, endometriosis, um, even miscarriages, kind of revealing that there's something going on? Is there other things that women would be surprised to hear that's kind of revealing itself to be an issue?
Yeah, those are definitely the biggest things that we deal with. When we do a full workup, we're always looking to make sure, for example, that your tubes are open. We always want to check that because if those aren't open, that's going to obviously affect your ability to conceive. We look for things in the uterus, maybe there's a polyp or a fibroid. Those could cause symptoms, but they also could cause difficulty with implantation. Some different uterine or vaginal infections could contribute to some issues. So we always look for that. And then, kind of going back to the surgical abdominal survey that we do, pelvic adhesions could be an issue as well. So say that someone had a surgery in the past that could have led to abdominal adhesions or some type of infection could lead to abdominal adhesions or pelvic adhesions. So we definitely always do a very thorough full workup, which I think is really, just so important. But what you mentioned really are the main things that we typically see. The other things are less common, but if they are there, very important to address.
Hmm. Have you ever had because I think some women, it's very obvious through the symptoms what it is that they're struggling with, but sometimes it can be a little bit complicated to figure out what's going on. Have you had women that might be experiencing, painful periods and PMS, and maybe they've had, like a miscarriage or two, but they're also able to, have other children and kind of go about their day, and there's nothing too alarming that really do have an issue. So is that something that happens, or would you say no, you're doing fine? It's probably something less. It's not something, like an endometriosis. Excuse me, endometriosis. It's probably just you need a little bit cleaner lifestyle or something like that.
Yeah, I would say if you've tried to conceive with timed intercourse for 6 months, so timing
Mhm.
intercourse with when you're ovulating, you're timing intercourse appropriately during your fertile window. If you're not pregnant by 6 months, something is going on.
Mhm.
But something that you're kind of alluding to is with endometriosis, the symptoms are so variable. So I think a lot of women have heard in the past, you don't have any pelvic pain, you don't have any bowel bladder symptoms. There's no way you have endometriosis. And that's just not true. Sometimes the primary symptom of endometriosis is infertility. So if you're not pregnant by 6 months, you really need to work up for that, even if you don't have any other symptoms. Endometriosis is so strange. It can present with really painful symptoms and you only have a little bit. It can present with no symptoms and you have a ton of it in your pelvis. We just don't know until we look. But I think the number one thing I would say is if you're not conceiving by 6 months of timed intercourse, there's something going on. We just have to do that evaluation. And I should mention, of course, the male partner, your husband, is a factor in this as well. So we do need to do a semen analysis and identify if there's something going on that end as well.
That is very true. Often, the issues are, you know, kind of pointed at the women, or like, you can't get pregnant, there's something wrong with you. I've recently ran across some studies that have been done about miscarriages, saying that it's a lot on the man and his health. And I don't really know what it would be about his health that would be the issue. But man, I wish I could remember the doctor that was talking about it, but they were saying a lot of it has to do with the man, including, if you do get pregnant, things like the placenta and the quality of the placenta, things like that are because of the quality of the sperm. And so how often do you run across it not being maybe the women's a problem? I don't know a better way to say that, but how often is it that we kind of forget that men also their fertility matters and it's not, it's also affected by everything that's going on, stress environment, or just genetic things. How often do you run across that?
Yeah. So we do for infertility patients, there should always be a semen analysis done. That's always super important. And I really think, again, with the infertility rates rising, I think we're seeing more and more abnormal semen analysis. So they really, it's not uncommon to have an abnormal result. So super important that that's done. And then also a lot of those lifestyle changes that women are making, their partners, their husbands should be making with them. So, avoiding alcohol, smoking, whole foods, that types of thing. And then depending on the abnormalities, there's medications or supplements that we can use to address those as well. But always, always should be part of the conversation.
Hmm. There's a lot of studies that's been done that shows that the men have lower testosterone now than they did. I don't know how many years ago now, 50, 70 years ago, which is super interesting. And like the fertility rates in women are falling, it sounds like men are struggling in that area as well. And so I just find that really interesting because I'm wondering what is the common thread between the two that both parties are suffering? And is there any research out there that you've run across that would kind of answer that question? I don't know if we've kind of gotten that far yet. I don't know if it's too recent of an observation, but it would be nice to know if there is, some sort of an answer.
I completely agree. Yeah, the fact that we're seeing an obvious drop in the testosterone rates is really alarming, and it makes total sense with this increase in fertility. I personally think it's really got to be environmental, and again, the research just isn't there. I don't think we really know or are able to pinpoint that. So unfortunately, I think if you're going to approach that, it's you kind of cast a wide net and just try to really limit those environmental exposures that you could have. But yeah, it is very alarming. I completely agree.
Yeah. Is there if you could tell women one thing about their fertility that they should absolutely do um to support, what would it be? I
One
know
thing
there's a lot of different things, but if there's maybe even a couple main things that's really in their control that they can just to make sure that they're doing what they can before, maybe going and seeing someone, what would you recommend?
So I think a great place to start would be charting your cycle. I think a lot of women, obviously have their period that kind of crosses their mind when it happens, and then they don't really pay attention to their cycle again until they have their next period. And so when I would see women at my last job, they might not even know how often their periods are, how long they're bleeding. And then there are other signs your body gives you that something is abnormal. So sometimes women have spotting before their period, they'll have brown bleeding after their period. They won't have as much mucus as they should leading up to ovulation. So if you're actually dialed in and charting your cycles very thoroughly, that gives us so much more information than just saying, oh, I think they're 5 days and they're not bad and they happen once a month. That's usually the answer I get from women not charting their cycle. But when you actually have a chart in front of you and you can identify abnormalities, they stick out and they give us so many clues as to, just looking at the chart, are your hormones off? Could you have endometriosis? There are things that are jumping out that tell us, this woman isn't trying to conceive right now, but based on this chart, she might struggle to try to conceive because she doesn't have enough mucus. So I think charting your cycles, being in tune with your body, listening to your body is so important. And I think it kind of helps those red flags to jump out if you need further evaluation.
Hmm. Are there resources you would recommend that women look at? I don't know, books or maybe even articles or kind of why other professionals that they can, I guess, listen to or look to kind of start that because
Mhm.
we're starting as teenagers going through this and hopefully it's getting better now, but when I was younger it was okay, chart when you're having your period
Mhm.
and it should be this many days and your cycle will be between this many and this many days, and that just was the extent of it. But from what you're saying, there's so much more that we should be looking at. So is there something that women can look at to really inform themselves, and kind of have on hand that I would also love to share, and link on the website just so people can go back to it.
Yeah, absolutely. Um, so I think the crate model charting system is really amazing for identifying those red flags. So if you're someone who is struggling to conceive or you're concerned that you have something going on, charting with crate model is probably going to be the place to start. And that is something that you could find an instructor online. Meeting with an instructor really gives you the best success rate. It's a little intimidating at first when you start, and so you really need that teacher to work with you. So I would recommend maybe if you're concerned that something's going on, starting with an instructor to really chart accurately. Otherwise, you can always follow me on Instagram at Dr. Jessica Miller. And I try to just put some information out there that maybe isn't what you're typically hearing. And of course, there are other NAPRO physicians across the country. Again, with you in St. Louis, there are some people there that have the same approach and mentality and really can kind of help you get to the root cause. I think that's probably the best place to start.
Okay, that's great because yeah, those of us who have started families and after having children are jumping back into, okay, my cycle is starting up again and it's looking a little different and it's new and I don't know how to, I don't know what to do. I don't know who to go to. That is really helpful that that's a reliable um, model and there are people who you can reach out to who will teach you
Right.
what to look for. And yeah, I was looking on your Instagram yesterday as I was prepping a little bit. Um, and having professionals who are raising kind of those questions or even just those things that you're like, you should look out for this or you should be asking these questions. It's so helpful because, like I said, we're really entering into that
Yeah.
natural approach, and it's wonderful to have people that we can trust that are not afraid to be like, okay, that does sound a little crazy, or the approach you're trying is not, what we've been doing for the last 50 years, but I'm willing to sit there and we can figure it out and we can go through it. And maybe it's not crazy and maybe it does work. And we just need to kind of get back to the basics.
Yeah, absolutely. Just letting women know that there are other options out there because I think sometimes they try to advocate for themselves and they just get shut down. And so just letting women know there are people who practice differently. There are certain questions or red flags to look for that can help you. So, I don't always recommend social media as your primary information based, but if you are finding it from licensed individuals who really are, experts in their field, I think that's a little bit different. So sometimes just getting that information out to women, I think helps them to advocate a little bit better for themselves.
Absolutely. Well, before we wrap up, I always ask all my guests the question: if you could give women one piece of advice, it could be on this topic or it could be on really anything else. What would it be?
Oh, see, you should have given me a heads up on this.
Sorry,
A big question. One
I'm
piece.
sorry.
Oh
I
man.
know it's loaded. It's loaded, and you've already just given us so much information, so much knowledge. But I think sometimes I do like to open it up a little bit because I think from it allows personal experience to really play in of, well, myself as a woman, this is what's been so helpful, either for my own fertility, on this topic or just life in general. And so I just like to open it up and just kind of see what we get.
Well, this is kind of off topic because we've been talking about infertility. So we've been talking about women who really desperately, typically, haven't had any children and really desperately want to be a mother. Um, so this is a little bit geared towards a different population, but I think that in our current society, there are so many young women or middle-aged women who want to start a family but are scared to do that. I think society tells us that your life is over when you start a family. You're not even going to know who you are. You're not going to have any time for yourself. It's so horrible. I feel that message coming so horribly onto young women today. And so I just wanted to encourage women who haven't started a family yet and are kind of nervous about that or don't know if it's for them, that it is just, it's a leap of faith that is just the most incredible, amazing journey. And so I just want to encourage anyone who's kind of stuck in that lie and, stuck kind of focusing elsewhere in their life and not sure if they want to take that jump. It is incredible. It is so worth it. It is the greatest gift. And I just don't think enough people know that, honestly. I don't know.
Well, I think it comes with a lot of weight from you because you went through it. You're a mother, but you're also professionally, you're helping all these women who are suffering in these ways, and just day in and day out, having to try and figure out what is going on, and it's you're seeing affecting their not only their physical health, but their mental health, their just like spiritual health, just the weight of it all. And maybe even their entire relationship, with their husband, with their family can get complicated. And yet your advice is still don't be afraid. It's worth it. It's incredible. It's the best thing ever. And I think it just carries a lot of weight coming from you.
Well, thank you.
Well, Dr. Miller, thank you so much for coming on and just diving into this entire topic with us.
Yeah, thank you so much for having me. This has been great.
And thank you for listening to the Woman Aesthetic Podcast. And I hope that you enjoyed this episode. If this episode resonated with you, share it with a friend or a loved one. And I would be incredibly honored if you would subscribe or leave me a review or a comment. Until next time.